Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Today, we will be joined with Dr. Keith Gray, Senior Vice President and Chief Medical Officer at UT Medical Center, and I'll be turning it over to him shortly. Yesterday was World Tuberculosis Day, a commemoration that exists to educate the public about the impact of TB around the world. So today, our moment of gratitude is for our team working in TB here at KCHD, as well as our state and federal colleagues for their efforts to prevent and control the spread of this devastating communicable disease. The low burden of disease here is a testament to the effectiveness of public health principles and the hard work of professionals here and across the country. So we're grateful for them. I'll now transition to our vaccine update. Effective yesterday, we encouraged all current COVID-19 vaccine providers in Knox County to offer the vaccine to anyone 16 years of age and older as soon as their supply and registration and resource systems allow. Opening up vaccine eligibility in this manner is a momentous step in our efforts to protect our community. Our website was updated yesterday to reflect this change, so anyone age 16 and older may sign up on our website for a wait list. We continue to move through our wait list very quickly. Since its launch, there have been more than 50,000 entries, and as of yesterday afternoon, only 5,600 remain to be notified of an appointment opportunity. We're sure there'll be more registered today with the expansion of eligibility, but we're proud of the incredible progress that we've made and that our team's made. We'll now bring up our vaccine information webpage with some important updates. I think they're bringing that up now. Because of the continuing partnership between public health and hospitals and medical providers across the country, more than 175,000 vaccinations have been reported among Knox County residents. Nearly 25% of people, that is 1 in 4 people, having at least some level of protection against COVID-19. This is excellent progress and something that we will continue to build upon. As we've stated, our strategy continues to be to encourage as many access points as possible throughout the community. Utilizing the full public health system will provide the best possible access. This includes the myriad of other medical providers in our community that I just mentioned that we've been working with. We will continue here at KCHD to help fill gaps and coordinate with partners to expand vaccine access across the community. We continue to encourage community members to look at all the vaccination opportunities across the area, whether it's at a hospital or a pharmacy, health departments, or medical provider offices. And the best place to find out how to do that is to go to Vaccine Finder, and there's a link to that website on our website as well. And remember, getting vaccinated not only protects you, but also your loved ones and friends who may be at higher risk of complications than you. And now we'll move into the local situation. We have 50 new confirmed cases since yesterday's report. 961 are active cases. 35 Knox County residents are currently hospitalized. And sadly, we have 1 additional death to report today that raises our county's total to 605. Since we last spoke with you, our community has reached another somber milestone in that we hit more than 600 deaths. Please continue practicing the 5 core actions, regardless of whether or not you've been vaccinated. And please seek vaccination as soon as you can. If you're unsure or have questions, please talk with your healthcare provider so you can make an informed decision. All of our actions have a very real impact on the rest of our community. And now we'll move to the weekly benchmarks. As a reminder, all of this data is available on our website at covid.knoxcountytn.gov. The first benchmark, sustained reduction or stability in new cases for 14 days. For this past several weeks, this benchmark has continued to be green due to the lower volume of new COVID cases across our community. Over the past 2 weeks, we've seen daily new cases at approximately 53 cases per day, which is consistent with the previous reporting periods. It is important to note on that front that we continue to see a plateau when we'd rather see these numbers continue to decrease. So we want to still urge everyone to please, again, I keep saying it, practice the 5 core actions and get vaccinated as soon as you're able. But because of these factors, we do continue to represent this benchmark as green. Our second benchmark, community-wide sustained and increased diagnostic testing and consistent or decreased test result reporting turnaround time. Regarding lab turnaround time, this figure remains under 1.5 days, as it's been for the past several reporting periods, and that's a good side. But regarding testing, we continue to see low numbers. They dropped by about 800 tests for this reporting period. We remain hopeful that this decrease is due to a lower disease burden across our community, but we're keeping a close eye on this metric. But because of that lower testing, we are representing this benchmark as yellow. Our third benchmark, sustained or increased public health capability. During the past week, more than 25,500 vaccines were administered. That's up from 22,700 the week prior. We continue to see an increase in the total number of vaccines administered every week. Now, we must stress that while we are encouraged by the vaccine progress we are seeing, this metric is about access and vaccine availability for the public. This is no way intended to be an indication that we are fully out of the woods. We absolutely, and it's the theme of the day, still need everyone who hasn't yet been vaccinated to get vaccinated and still follow the 5 core actions. But as you can see, overall, we are definitely trending in the right direction. And for those reasons, we are representing this benchmark as green. Since Dr. Gray is here with us today, I'm going to move on to the 5th benchmark and supplemental data, and then I'll allow him to elaborate on the local hospital situation in his remarks. Our 5th benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. Over the past month, the number of deaths has decreased, and we continue to see an average of less than 1 death per day. And while this is encouraging, we want to see this continue to trend down and not plateau. The information available at this time leads us to represent this benchmark as yellow. Under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of yesterday, our 14-day trend line shows 11 new cases per 100,000, and our 7-day trend line shows 12 new cases per 100,000. Both of which have remained fairly consistent over the last month and really does help to illustrate the plateauing that we're seeing in our cases. So again, not the time to take our foot off the gas. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is just over 10%. Again, we want to see this trend down and not hover at 10%, as that's another indication that the disease is still present in the community at higher levels than we would like to see. And then finally, for the 4th benchmark, getting ready for Dr. Gray, healthcare system capabilities remain within current and forecasted surge capacity, and this is represented at green again this week. And with that, I'll turn it over to Dr. Gray. Thank you.
Thanks, Charity, and good afternoon to everyone. Charity and I were talking prior to going on the air and saying that this may be my last event related to COVID in this forum for a while or maybe ever. So I want to take this opportunity to offer my own moments of gratitude while I have your attention. The first is to the Knox County Health Department, and you've heard me talk about our relationship and collaboration before, and my sentiment toward that relationship remains the same. I would just want to congratulate them and thank them for being at the tip of the spear as it relates to helping Knox Countyans and East Tennesseans navigate the COVID-19 pandemic. It's not over, I'm not saying that, but what they've done so far has helped to keep us safe and get us to this point. They've been in the hubs of the spokes of the community, specifically the health systems, to not only help us navigate through PPE issues and hospitalizations and new cases and things like that, but now to help us get as many people vaccinated as quickly as possible for our entire community too. So again, I just want to thank the Knox County Health Department and congratulate them on a job well done. I also want to thank the community for what you've done in being compliant with the many things and often various things and changing things that we've asked you to do over the last year. We appreciate the partnership. We appreciate our community and county leadership, our mayors, our first responders, our healthcare workers, and really all the members of the community for your resilience throughout this time. I think Knox County and East Tennessee has handled the COVID-19 pandemic as definitely as well as anybody in Tennessee, and maybe as well as anyone in in the United States. As I was last year, I think on January 19th of this year, and I think my parting comments were that I remain vigilant, but I'm hopeful and cautiously optimistic. Again, I think I feel the same. I want to remain vigilant. I don't think we're out of the woods yet or that we can let our guard down. I still continue to advocate for the 5 core measures. However, I am optimistic. I am very hopeful that we're moving on and we'll be able to resume some of the normalcy that we knew prior to COVID, specifically interacting with each other. All of us have been impacted negatively from COVID, but I think the mental health impact has been under-recognized and underappreciated, and I think it will make a big difference when we can start to gather again and see each other's faces again, and I look forward to that. Having said that, when I was also last year, I was about 2 weeks out of the peak of hospitalizations in Knox County. At that time, or in our region, at that time, we had nearly 700 hospitalizations related to COVID. I am proud to say that we have seen a precipitous drop in the number of new cases, as Charity mentioned, but also in the number of hospitalizations and a number of deaths related to COVID. As of yesterday in the region, we had only 95 hospitalizations. So almost a 7-fold decrease in the number of hospitalizations in our regions over the last 2 months. And we've seen that same plateau that Charity mentioned before in the number of new cases and hospitalizations and obviously related deaths in our region. ICU percentages of that continue to be 20 to 25% of our hospitalizations are patients that are in the ICU, and 20 to 25 to 33% of those in the ICU are on ventilators. But all of that, as our capacity indicates, our capacity monitor indicates, is green, and we feel like we're clearly able to handle our COVID volume in conjunction with our other volume at this point. Next thing I want to talk about is where we are from a hospital situation and you addressing your other healthcare needs. Again, we want to continue to urge people that are negatively impacted by COVID to seek help. If you need to be hospitalized, we can do that. But for those that are seeking medical care or need to seek medical care unrelated to COVID, our hospitals are open, our hospitals are safe. We are continuing to keep our top priority, keeping our community members and our team members safe. So having said that, we're continuing to screen visitors. However, our visitation policies are more liberal than they were the last time I was here. We were only allowing 1 designated visitor at that time. All of the hospital systems have agreed to open up their visitation to 2 non-designated visitors, meaning 2 visitors at a time. They don't have to be the same 2 visitors repeatedly. That's what that means. Now, again, please check with your local hospital systems to see when that will be enacted at each respective system. But again, we have agreed to do that. We realize the importance of having family members with their patients while they're in the hospital to help them navigate and recover from their illness. We learned that and heard that loud and clear during the COVID pandemic when visitation was restricted. We have resumed all elective cases. I think it's safe to say that our case volumes are back to normal, but we do have a backlog for patients in the community that have been resistant to come back to the healthcare systems. We, again, encourage you to come back. We don't want you to defer needed healthcare and exacerbate your illness and make it worse when you do decide to present to have those needs met. And the last point I want to make is that while we continue to provide for comprehensive needs of our healthcare community, part of our focus related to COVID-19 has shifted to vaccination. Again, the Knox County Health Department has been at the center in helping us coordinate vaccinating as many people in our county and in our region as quickly and effectively as possible as the supply of vaccine allows. Part of our focus has been educating our community on the importance of vaccination, as you just heard from Charity, but also emphasizing equity and access to the vaccine. And so having said that, we partnered with Knox County Health Department to take the vaccine to underserved and hard to reach areas or areas where we think there may be more resistance than others. We've been very successful in that endeavor. And as you've heard, the result of that has been 175,000 vaccinations, at least 1 shot in our county, which is phenomenal. And again, we haven't seen some of the disparities related to underserved areas and other areas in our state and in our nation have experienced. And so again, I circle back to how I started. I'm just really grateful for the collaboration and partnerships to bring us to this point in the COVID-19 pandemic. So I'll pause there, and I think we'll open for questions, and I'll give the podium back to Chair.
Yes, as a reminder to our media partners, if you have a question for Charity or Dr. Gray, please note who the question is for. You can start submitting those now. Our first question, David from WVLT. Can we get updated waitlist numbers?
I gave them in my talking points. 1 second. Sorry about that. I walked off without them. I believe it was over 50,000 folks total ever on the wait list. And as of yesterday afternoon, we haven't pulled them today. We had about 5,600 that were still in need of being had an appointment made available to them. And we're working through that very quickly.
And the next one's for Charity as well. How is Knox County planning to vaccinate high schoolers who are 16 and older? Will students be prioritized similar to school staff? Options to be vaccinated at school clinics so schools can be safer by the fall.
So for the 16 and under crowd right now, we actually were just talking about that, I think yesterday, maybe on a call. Encourage you to make your appointments as you can now at the myriad of available places that they have to make those appointments. The 16 and older is, I don't want to say this wrong and I always mix them up, it's Pfizer, correct?
16 and older, Pfizer.
Pfizer. So you can only get Pfizer vaccine if you're between 16 and 18. And so seek out opportunities with those. So our partners at Children's Hospital and the hospitals have Pfizer. We have Pfizer. But when you go to vaccinefinder.org, look for those. And then as far as the larger school population, we are in the discussion phases of what that's going to look like. And we'll get back to folks soon or as we can on what that plan looks like.
Sorry, 1 second. Okay, from Vincent from Knox News. Has UT Medical Center seen any variants of COVID-19 in their service area? If so, which ones and how prevalent are they?
We're not aware, UT Medical Center, and I think I speak for the health systems at large, has not seen obvious high penetration of variants, and that doesn't mean that they're not here. But I was reading this morning that at least the latest data that I've seen is that there may be as many as 12 different variants, with the latest coming out of India. I think that news broke probably 30 minutes, 45 minutes ago. So again, they may be here, but we haven't focused a lot of attention on variants or changing what we're doing to get as many people as possible vaccinated. And I think Charity has more information on that.
Thank you. I agree and echo with what Dr. Grace said. Also, that's another reason to really stay vigilant in the 5 core actions. And again, seeking vaccination. It's been described as a race between vaccinations and variants going. So we want to stay ahead of that. So want to put a plug in there. I can say overall for Tennessee, we are seeing variants across the state. The major one by far still is the variant coming out of the UK that we've talked about before then.
Allie with Knox News for Charity. Since Pfizer is the only vaccine authorized for 16 and 17-year-olds, how is KCHD ensuring these individuals get their shots and enough is available?
Well, again, that population opened up with everyone else. And so we would encourage folks to seek opportunities. And on Vaccine Finder, that website, you can actually see the type of vaccines that the different providers have. And so we encourage them to seek out those opportunities where there's Pfizer. And I can say our vaccine that we have right now in our clinics and for the next little bit at least is Pfizer. So you can also seek out opportunities for ours. And if we have any other plans, again, we'll announce them when they fully develop.
And the second question with that, when Knox County requests vaccine from the state, can providers ask for particular brands?
Occasionally. That one's a very complicated, Dr. Gray's laughing because he knows. That's a complicated question and answer. It's yes, we can put in specific types of requests. but that also what you actually are able to be allocated and receive is solely based on, or mostly based on supply and what you're able to store and do all of those things safely with. But I will say right now, the largest volume of vaccine that's out there is Pfizer, followed by Moderna. Johnson & Johnson's probably, Dr. Gray and I were just talking about this as well. Johnson & Johnson availability is probably where we're about a month or two ago with the Pfizer and Moderna. So it's starting to build up, but not quite there yet. So our hospital partners are still mostly in the Pfizer business. They're doing some others. We're mostly in the Pfizer business, and then we're trying to get the opportunities for Johnson & Johnson and Moderna that are both easier to manage to all of our other community partners. But there's also some federal partnerships as well. So again, I can't stress enough, folks need to go to Vaccine Finder to look for opportunities.
Hey, Vincent with Knox News. We've seen a plateauing of cases and a decline in deaths. Have either of the KCHD or UT Medical Center noticed a change in which demographics are getting sick, hospitalized, and dying in recent weeks?
Do you want to go first and then I can say them?
You know, I think we've noticed an evolution of the data over the last year. I think when we started this conversation early last year and then into the summer, there was a lot of talk about disparities as it related to folks with comorbidities, but also race and ethnicity. I looked at the Knox County Health Department data as late as this morning. And again, one of the other things that I'm proud about in this community is that we don't see a year later the disparities in the number of people with the disease, the number of people hospitalized, or the number of people that died from the disease as it relates to race and ethnicity. So we're really proud of that. So I think what we're seeing from a hospital standpoint is really the same demographic as I talked to you about last time. It's really those 55 and older. And I think that's a national trend, but there's really been no recent shift in the demographics. But I am proud of the progress that we've made because of the intentionality of the Knox County Health Department and others in this community.
And again, I would echo exactly what Dr. Gray said, and we have the, just trying to think on what we're seeing too is I think our decline in deaths and hospitalizations really goes in line with it's that demographic that's still unfortunately getting hospitalized and dying at greater rates, that age demographic. And I think we're seeing that decline because that population's who's largely been vaccinated in our community. And so I think it's a testament to what the vaccine can do. And again, encouragement. I looked at CDC data this morning. I think we've seen over 85 million vaccines in the United States thus far. And it's safe, it's effective, and it's doing its job. And we want to encourage that.
Okay, Austin from WATE. What is the average time spent on the wait list?
That's actually gotten, I don't have an exact number, but I can tell you it's getting smaller. It's getting shorter. And so I believe that folks that just were signing up are starting this past week are getting invited to opportunities as we speak. So it is not a long time for our wait list. I also do want to recognize again that wait list is the wait list for our clinics. And that there's lots of other opportunities out there as well. But the time is definitely shrinking as the wait list, the numbers of people on the wait list that need to be contacted is shrinking.
Okay, Allie from Knox News for charity. Are people allowed to get fully vaccinated with one type of COVID-19 vaccine and then come back later at a later date to receive a different brand? Is this safe?
We would not encourage that. So once you get vaccinated, you're vaccinated, and we encourage people to allow those vaccines to go to other people who have not been vaccinated yet.
Okay, Vincent, Knox News. So if I'm hearing you correctly, there is a decline among those 55 and older, but the bulk of deaths is still 55 and older.
Yes, I think that's a good summary.
If there are any more questions, please submit them to the chat, please. One second, they're typing.
Okay. This is when we always say we wish we had music. Oh yeah, Dr. Gray, while he's making a good point, is encouraging folks to make sure you do follow up and you get your second dose. There's been some national news coverage. I don't have data at the local level on that. that there's some folks that aren't doing that. And so it is very important. And we do want to encourage people to please follow up if you did get a Moderna or Pfizer with those second dose appointments at the location where you got your first dose.
Okay, Vincent from Knox News. Is there any way for me to see that decline over time? Currently, the death and demo data on the KCHD website does not break this down over time.
We will have to talk about that, Vincent. I'm not sure how we can get that to you, but we'll talk about it as a team and follow up. And when I'm speaking of trends. I see the hospitalizations all the time. I see the data on the deaths all the time. So I'm talking overall time trends that what we're seeing, those numbers have gone down. They still remain within that demographic though.
And then Allie, what is stopping people from being vaccinated at 2 places? Is it the responsibility of the provider to check?
In the high throughput clinics, that's a hard thing to do because those clinics where we're trying to get a whole lot of people, 600, 1,000 people or more vaccinated at one time, there's not time to stop and check on everybody's vaccination status in advance. And so we really ask people, again, just like we do with your comorbidities before and all of those things, it's on the honor system. And once you've been vaccinated, you're protected. They are all extremely effective in preventing hospitalizations and deaths, like at the close to 100%, if not 100% range. And so let those other vaccines go to other people. I don't hear of that happening a lot, and I'm happy about that. I haven't heard about that happening at all, actually, that I know about. But we do want people to, once you're vaccinated, you're covered, let other folks get vaccinated.
Vincent from Knox News. Has the state indicated that they will supply additional vaccine to meet higher demand in Knoxville? They did this for Nashville recently.
So yeah, that was a big mass clinic, and we're aware of that, and we do know that the commissioner said this past week that in the coming weeks, so we're always kind of like a week behind. So you get told your numbers of vaccines you're getting one week, and then they're received the next week. So the week following, we should start seeing about a 30% increase, hopefully, in vaccines. So continuing that upward trend. And then the state is absolutely willing to work with us on a large vaccination campaign for our area. And when we get to the point to be able to talk about what that'll look like, we will.
Okay, if you have any more questions, please submit them now. Okay, Vincent from Knox News. Is KCHD worried at all about flagging rates of vaccination in surrounding communities?
Vaccine hesitancy, and I'd actually like Dr. Gray to speak on this too, if he doesn't mind, because I think hearing from other folks is helpful. It is a concern. It's very important. Lots of folks have different reasons why they may be hesitant to get the vaccine. But again, 85 million doses across the country, 175,000 here. We know they're safe. We know they're effective. We encourage people to get them. If you're concerned, we ask you to talk to your provider. We know people like to get their guidance about their health and their information from their doctors. And so have that conversation with them and then find other trusted sources. Do you want to add anything?
No, I just want to echo the exact same things. I think, part of a way to overcome hesitancy is education. And so people that are hesitant need a reliable source that is informed to share with them the pros and cons of the vaccine, to talk about side effects of the vaccine. And again, not everyone will consent even after that, but I think you will see an improved uptake of the vaccine. And then lastly, today I'm out in the community visiting with all the UT Medical Center primary care sites. And one of the recommendations I heard this morning is that, patients trust their primary care doctor. So as more and more vaccine becomes available, and as it becomes easier to handle, especially the vaccine like J&J and Moderna, getting those to primary care sites may decrease the hesitancy and increase the uptake in vaccination. But I think education and trust is the major barrier that we need to overcome in order to improve uptake on vaccine.
Awesome, and that will be our last question for today as we're at our time. So thank you for all of your time, and we hope you have a good and safe rest of your day and a safe weekend.
Thank you, Dr. Gray.
Thank you.